Jim Rosenthal. Welcome to Eye on Art. We're here today with Laura Seftel in the Art Therapy studio of Northampton. Laura, thank you for having us here today.
My pleasure. Welcome.
Tell me a bit about how you got started as an art therapist.
Well, I was always interested in art, and I had a BFA in painting, and I wanted to find a way to work with people and combine psychology with my work. And when I heard about art therapy, it was a good match for me, and I pursued a master's, and then went on to become registered and board certified with the American Art Therapy Association.
What steps are involved for someone with a master's to become registered and board certified?
So most art therapists do have a master's degree, a 2-year master's, which combines clinical work as well as understanding how art can be involved, integrated into therapeutic settings. And we undergo internships, supervision, and then can become a registered art therapist. And then if one wants to go on and take an exam, a national exam, you can become a board certified art therapist. You can't enter private practice until you have a certain number of years under your belt. And it's a really good idea to get out there and work for different agencies and clinics and hospitals so that you become very familiar with the needs of different populations and the different kinds of issues and challenges that arise. And then when you're ready, one can open a private practice.
What are your goals when you have a new client come in?
Right. The first thing I really do with people is try to help them, begin to help them feel comfortable with the materials and to help them understand that this is going to be very different than their art classes in school, that we're not focusing on the product as much as the process. Okay. So what we're going to do today is we're going to use art supplies in a way that may be different from how you use them in art classes, where you're really worried about the product and creating something to hang up. This is more about using art for an experience, and we're looking more at the process than at the product. So it's a really very spontaneous kind of playful approach to using the materials. What we're going to do today are 2 warm-ups that I use with adults. And if you have a group of 5-year-olds and you ask them how many of you are artists, almost all of them will raise their hand. But when you have adults and you ask them who's an artist, very few people will raise their hand. So part of our work in art therapy is actually very democratic. It's to help adults feel that they can make art and that they can use art materials. And it's really about developing creativity and giving people back their spontaneity with materials. So in a way, it's kind of like regaining what we lost when we were kids, being able to express ourselves spontaneously.
Let's talk about the group that we did here today. Tell me how you normally get started, how you break the ice.
Well, the warm-ups that we did in this workshop are a perfect example. The way that, particularly in groups, it's really important to to kind of recognize that everyone's coming with an inner critic. Every adult is coming with some thoughts about feeling somewhat apprehensive, either about what their art will reveal, or that they don't know how to do it, or that it won't be right. And so the first thing I do is really address that inner critic stuff and really work to make it comfortable and playful. And so doing warm-ups is perfect. When I ask them to crumple up the paper, it's perfect because they've already ruined the paper. And so there's no concern about, oh, my first mark is going to be the wrong mark.
It's a little less inhibited.
Absolutely. It's really about developing a new relationship with materials, different than what they may have developed when they were in school. And what I'm going to ask you to do is kind of crazy. I'm going to ask you to crumple up your paper. Just crumple it up. There's no right or wrong way to do it. I mean, really crumple it. Oh, yeah. Crumple it up. Give it a squeeze. Do whatever you want to it. I can see that this is a group that could just spend an hour and a half crumpling. So the next thing you're going to do, that was very good crumpling, by the way. The next thing that I want you to do is take a look at your paper, look at it from different angles, look at the kind of topography that you created. You can turn it over, look at it from different directions. And as you're looking at it, you can see if images begin to pop out at you, if some kind of image or shape begins to emerge. For some people, it happens right away, and other people don't really see anything specific. In which case, I would encourage you to just pick a color that's appealing to you and to begin to doodle and sketch into some of the shapes and lines that you see. And trust the process. Trust that an image will emerge for you.
I was paying a lot of attention to you.
Yes.
Watching our clients here today, and you were observing them and you were listening to them. So in your own mind, there was perhaps some diagnosis going on. What kinds of issues would I want to pursue?
Right.
And then from the diagnostic, then you start thinking about what things might we want to help resolve for somebody.
Right. My first and foremost reason for being there is as a compassionate witness and as a guide. I don't see myself primarily as a diagnostician, although I bring 15 years of experience of watching people use art for healing. And I did take courses in assessment, and I do have certain things that are going to jump up. For instance, when I was working with one of the participants, she drew apple trees, and apple trees is a very classic art image of nurturing and representing the mother. This is a classic interpretation. But that's meaningless until I check in with the client and we make meaning of it together. And so it's less of a sense of me sitting there and saying, I think I know what this is all about, and more of being able to sustain a very present, be very present and being a container for what's happening in the group. And being able to tolerate a sense of not knowing and a sense of mystery, that we may think we know where the creative process is taking us, and often it surprises us. And what I think is going to happen next, or what would be the most healing thing to happen next, is not always the case. So the creative process has its own logic. And so there's a real sense of me being a guide, a very experienced guide, and at the same time having a healthy respect for the mysteriousness of the process. So, let me check in with you. What was it like to do this experience? What was it like to do this exercise? How was it when you started out, and did anything change?
Well, at first I saw the paper, I kind of felt like,
That's one of the reasons that we do this exercise, is because it begins to teach the participants to trust their creative process, that you don't have to try too hard, that if you step out of your own way, really the imagery will begin to emerge from your own history and from your own perceptions. So it's much easier than being faced with a blank piece of paper, where people sometimes feel like, well, I'm not an artist, I don't know what to draw. When we do this, after we've wrinkled it, we've already ruined the paper, so there's no anxiety about how good the image is going to be or what it's going to be about. So it's a really wonderful exercise. It's really interesting with the art because it's not only just for assessment, like to find out more about yourself, but also you can feel things changing when you're doing it. You can feel something shifting in your own process. So that's the part that I get very interested in, is when we're actually making art and we feel something changing. As we begin to work together, we can use the art for two different things. One is to help them understand themselves better. So it's almost like an assessment, although I don't really use formal assessments in my work, as some art therapists do. But to kind of give us a sense of where we're at, what might the art, what kind of information can it reflect to us, almost like a mirror, to help us together make meaning of the art and find out where are the challenges for this client, and how is the art giving us additional information about where they might be stuck. And as we move along, we hope to use the art in a slightly different way, so it's less for assessment and more as a part of a transformative process, that the art begins to be part of a healing process. What we're going to do is something pretty similar. I'm going to let you pick whatever colors are attractive to you and give you some time, maybe 5 or 10 minutes, to play with the clay and to create an image, a symbol, a form that's very spontaneous. And as you begin, you really don't need to know what it's going to be. You can think that you know what it's going to be, but my experience is that things sort of evolve and change. So find the colors that are appealing to you. Don't settle for a color that's second best. Find the colors that you really want, and then you can play with it and see what emerges. Any questions? Okay, you got the hang of it. And again, this will be very spontaneous and playful. Yeah, I think that my experience is that these simple images, even though they can be done quickly and are playful in making, can sometimes access some very deep emotional feelings for us, or reflect to us something that's happening in our life or in our history that can be very meaningful and full of emotion. So if we were in a therapy group together, I would perhaps explore a little bit more with you about what your understanding would be of what those feelings were about and what this might represent for you.
So it sounds like there may be some parallels with psychology, but you're using the art materials to allow the patient to speak freely and perhaps to access some of their deeper emotions.
Exactly. The art process has a way of safely allowing people to circumvent some of their defenses, some of their daily, sort of the persona that we walk around with, and it very quickly enables people to go a little bit deeper. I'd like to just show you 3 pictures from a 12-year-old girl that I worked with in a residential program. She was very troubled and had a very, very difficult and traumatic childhood. And I worked with her over a year and a half as her primary clinician. And she was also receiving treatment, milieu treatment from the facility. This was one of her earlier images, which is a very disturbing picture because it uses black and red to represent a very disfigured face. And she actually ended up crossing out the face with red. As an art therapist, there are many disturbing things that I see in this picture, including the fact that there's no mouth, which means she cannot speak.
Or eat.
Or eat. That's true. She was extremely thin, and there were a lot of problems. It's a very good point. A lot of problems in getting nurturance into this child. And you can just see that she was not really able to complete this project, that it sort of self-destructed, and that was typical for her work.
Now this,
yes.
just in context, this is April 6th of 1998.
Yes.
So what do you have next?
So this is about midway through treatment. This was June.
A couple months later.
A couple of months later. I actually worked with her for a little over a year. And this was the finished product, but underneath this was layers and layers, which you may be able to see, of tempera paint kind of messed around and worked with her fingers and a paintbrush. She called this baby snakes. And this was a very kind of regressive picture, which I felt was a very healthy kind of regression. She felt very young when she did it. She was very open and trusting. And this is maybe some working through some developmental stages and expressing some emotions that she had not felt safe enough to do in her home environment.
Okay.
The last piece was done the week that she left the facility and was going to a foster home.
And so, what's the time frame on this?
This doesn't have a
Where is
date.
it?
This was approximately a year after that
Okay,
piece.
because you worked with her over a year.
Yes.
Okay.
This was a spontaneous piece that she created on our last session. And I think you can see, even without being an art therapist, that there are some dramatic differences, which the art therapy has a wonderful way of recording those changes. And what you see is a very beautiful finished picture. This took her a while to make. It's very centered. It's a very hopeful image with bright colors. The black and the red have disappeared. She's not destroying her work. And I think this is a very hopeful, very growth-oriented image. And it was almost felt like a gift to leave her.
The springtime colors, rebirth, and all that.
It's very beautiful, and I remember being very surprised and very grateful to see such a healthy image emerge from a child who had been so damaged. So she continued to have challenges, but this was a really beautiful symbol of the progress that she had made.
Now you said she left because she moved into a foster home.
Yes.
So that would be a successful conclusion. And how do you sometimes know when to conclude a relationship?
I think that's a perennial question in psychotherapy, and because my work tends to be, I usually work with people more than a couple of sessions, because I feel that the relationship is part of the healing process. And that is a very good question. I think that's something to be negotiated between the client and the therapist. And sometimes the art can help us, give us clues to help us know when someone is ready to graduate from therapy.
Isn't there a spectrum of art therapy from the therapeutic sessions that we've been talking about to some other venues in which art may be a healing experience?
Absolutely. And within the field of art therapy, from the very beginning, there has been acknowledgement that there are different ways that art can be used to heal. On one end, you could say there is the art in psychotherapy, really bringing art into the psychotherapy setting, and really coming at it with a very psychological point of view. On the other, so that's sort of a clinical approach. On the other end, you could say there's the art as therapy, the recognition that art itself is healing, even without bringing psychology to it, and that some people call it the studio approach, where we really get people in there making art in a very intensive way, and that in itself can be healing. So those are kind of two ways of looking at it. And then there's like everything in between. There's so many, it's an infinite number of ways that one can use art in a healing way. And what's exciting now is we're beginning to explore all these different ways of doing that, which may include having an artist in residence come into a hospital, or it may include having art exhibits in a hospital, or a drama therapist, because there are other expressive arts therapies too, drama, poetry, movement, music. So there's really this explosion right now, I think, of people understanding that the arts are healing and that we can use them in different ways in different settings. I think that more and more we're going to see art and medicine coming together instead of being two very separate disciplines. There is actually also a field of art therapy called medical art therapy, which is really growing, and that could include anything from having an art therapist on a pediatric unit preparing children for surgery, debriefing children from surgery, could be dealing with grief and loss. So there are many different ways that art and therapy are coming together.
You were referencing your workshops, and I know a number of healthcare providers come to you to receive some training in art therapy. Tell me about that.
Yes. I had found that there was a great interest in learning more about art therapy, but many practitioners were not in a position to pursue a master's in art therapy. But they did want to get some hands-on experience to understand better what this was about. So I designed a 7-week course to begin to give nurses, therapists, educators a sense of how the creative process can be healing, can educate us, and can be used in various educational and therapeutic settings. And while they understand that they're not getting a full training in art therapy, they come away from the trainings with enhanced understanding of how the creative process is healing and how they might be able to begin to integrate some of that knowledge into their work to deepen the work that they're doing.
Trained in Western medicine, art and art therapy has not been included in the curriculum, and we've spoken before. I know you have a little bit of perhaps Eastern background, and can you tell me a little bit about how some other cultures perhaps were more holistic in their approach, and that might be different from what we do?
Well, I think throughout time there wasn't a big difference. The shaman was, the healer, was using the arts in part of the healing. If you look at Navajo sand paintings, they're designed to heal someone psychologically, physically, and spiritually, and it involves making an actual image of a mandala, which is sort of a circle, a sacred circle, that the patient actually sits within it. And so in those indigenous cultures, there was no separation. They didn't say, well, this is art and this is medicine. It was part of their culture that we use the arts to heal, to create connections, to make meaning, to connect to our spiritual selves. So there was no artificial separation between the arts and healing and spirituality and medicine.
And so now we're kind of coming around
Full circle.
I know that you had a group, the Secret Club.
Yes. In fact, I'm glad that you mentioned the Secret Club. Usually I'm working as a therapist with clients, doing individual and group art therapy. This was a really different project, which was very exciting to me. This was unlike art therapy, where really anyone can participate, not just artists. The Secret Club project was designed for artists, and it is a project which is using the arts to explore the experience of miscarriage, which is a really hidden issue in our society. People really don't talk about it. And so we felt that the arts would be a really powerful way to sensitize people to the experience of pregnancy loss. So most of the people in the show are trained artists, and their work is very powerful and very strong. And this is a show that had not been, it's a kind of show that had not been put together before. It's a very unique show. And I think it was healing both to the artists as well as to viewers, and certainly sensitized viewers to this, pretty taboo subject. Similar to the Secret Club, there are other shows. For instance, the Psychosynthesis Center in Amherst produces every year a show called Through the Eyes of Cancer, and that is, another example of using art to explore a topic that's very difficult to talk about and articulate. And it's a way for the whole community to enter this dialogue around what is this experience. So there's really opportunities more and more for the arts to focus in on topics in our society that are unspeakable. Well, there 10 women initially participated in the show from all over the country, many of them from this area, but other areas as well. And this is a project that's continuing to grow, so we're welcoming new participants. But some of the artists, I think it's really nice to look at the artwork itself. One piece is by an artist named Ann Hill, who also happens to be an art therapist from Philadelphia. And she created several images of sort of abstracted body sort of figures in different colors. This one is simply called Green. Another piece by Kathy Ann Fleming, who's from Minnesota, also captures the physicality of the experience of miscarriage, which is something that's very difficult to talk about. But by painting it and sculpting it, these women have been able to articulate in a very powerful way what their experience was. This third piece is a piece by myself. I was one of the participants in the show, which was also part of what made it so compelling for me. And this is untitled, but again, it's very much about the emotional and physical pain and loss around pregnancy loss. Painting and writing were the two ways that I recovered from my own miscarriage, and part of what inspired me to curate the show. The last pieces are by Donna Estabrook. Following her miscarriage, she spent over a year producing, tremendous amount of artwork around this topic, and she has a lot of powerful artwork, a lot of it from a very spiritual place, and you can see in her work that she underwent a transformation in her relationship to that loss, and it's very clear that the art was instrumental in her moving through that grieving.
I made a memorial piece after a miscarriage, and it was very personal and said goodbye to the baby that I'd lost, and thinking that I couldn't possibly sell it, but I wanted to put it out kind of as to put it out in the public. Well, within 3 days somebody wanted to buy it, and it said not for sale. And but then I thought that after a month it had done the healing for me, and the person, it really meant so much to the person, and she hadn't even had a miscarriage. But she goes on in this story that I can't even remember at the time about how important it was to her, and so I let her have the piece.
There's some beautiful stories, all around this project, around how the art really was part of a personal transformation for the artists. Even though they may not have been conscious of it at the time, they felt compelled to paint these pieces and seemed very glad to have the opportunity to exhibit them. It brought closure, I think, for many of us. So, part of what was so powerful about the show is that even people who had had their miscarriage 10 or 20 years ago, once they started painting, the feelings were right there. There's a longevity to this kind of loss that really came through in the artwork, and it's very powerful experience.
Laura, this has been a fascinating look into a topic that is unfamiliar to many of us, and I thank you very much for having us here today.
My pleasure. Thanks for focusing your attention